All right, in the last video, we talked about core pressure, which dealt with optimizing the function of the muscles in the abdomen. This video is going to be about the rib cage and helping you understand, should I focus on the functioning of my abdomen or my rib cage? Because last video where we talked about the core pressure and we talked about really pressurizing the core, breathing into the core, for the majority of viewers, that's going to be a very helpful video. But there are some people out there who have very stiff rib cages. And the main thing they should focus on is actually getting motion between the rib cage. And when it comes to the abdomen, instead of focusing on breathing into the stomach as much, they actually need to focus on compressing and breathing into the ribs. And so I'm going to help you figure out if that's you. And if you're someone who needs to focus when it comes to core pressure, the main thing you're focusing on is breathing out, compressing the core, and then when you breathe in, not letting your belly just fall out, but instead keeping the container intact of the abdomen and really breathing into the ribs and abdomen. So let's go through a quick little drill to help you figure out, should I focus on really bringing the air down low and keeping it in the abdomen? Or should I focus more on just keeping my container intact and breathing in and out my ribs? Right off the bat, if you're someone whose belly kind of falls out and you have a really hard time bringing it in, if I were to tell you, suck your belly in as much as you can and it barely moved, you can barely draw it in, you might need to focus more on that and then breathing into the rib cage. If you're someone who puts their hands right here on the ribs and you take in 3 to 5 slow, deep breaths, and it feels challenging or stiff, you probably need to focus on the rib cage. There are people who, let's say, take the average female in high school in the mid-90s when it was really important to be as skinny as you could. She spent her whole life, or high school, whatever, sucking in her belly. That person would have a really good container and do a really good job breathing into the ribs. She needs to get better at pulling the air down, getting more density down here. Whereas there are a lot of males, I find, usually older in age, where their belly kind of falls out. And when they move and breathe, the belly and the air comes low pretty well, but their ribs are very stiff. So you have to kind of figure out what end of the spectrum you're on. If you're really good, if the belly comes in a lot, if it's hard to pressurize, focus on that. But if you notice that it's really hard your belly falls out, it's really hard to get motion in the ribs, then what you need to focus on is really just exhaling and then breathing into the rib cage. All the core exercises, all those motions, what you're doing is you got to focus on exhaling, breathing into the rib cage. Excellent.